If someone you know is suffering from chronic mental illness, there is hope. All of the research that we've been doing for decades is finally coming together, that these disorders are affecting brain metabolism. If we understand that this is a metabolic problem, we can actually offer more holistic interventions to that person. And instead of treating the cause with a pill, why don't we look for...
Harvard psychiatrist Dr. Chris Palmer, author of Brain Energy,
transforms mental health by uncovering powerful connections between metabolism and the mind.
If I just lose weight, will my mental health improve?
Yes, about 60 to 70% of people's calories now, on average, are coming from ultra-processed foods. That's a real problem. 50% of Americans now have prediabetes or diabetes. 93% of Americans have at least one abnormality in those 5 simple biomarkers. Those 5 biomarkers are...
I asked you something that what makes you uniquely you. And you said that you grew up hating yourself.
One of the primary drivers of me hating myself is that I'm gay. And then that just leads to this immense sense of loneliness. Like in the past, I would have gotten stuck there, but I don't get stuck there anymore. Trauma and stress can play a role in our metabolism. When that trauma response goes on for a prolonged period of time, it can actually take a metabolic toll.
How do you make sure that everything that you went through when you were younger, the criticism, the pain, how do you not let that interfere?
We can't, unfortunately, go back in time and undo that trauma. But what we can do is...
We want to make sure these conversations get to as many people as possible. By following this show and leaving a review, you can help these conversations reach the people they need to. If you send a screenshot of your follow and a review to @SarahAnnMacklin, I'll pick 3 of you to come down to the studio to meet me and the guest I'm interviewing and watch the recording live. In your email and message to me, don't forget to also let me know who you'd like to see on the show.
Dr. Chris Palmer, welcome to Live Well Be Well. I am so thrilled to have you here because mental health is a very important topic for me, and it's been a big part of the last 10 years of the work that I've done. So reading all your work has been quite pioneering for myself, and I really want to start this episode with hope because I'm aware that when we talk about mental health, it can be very hard, it can feel very shameful, it can feel very restrictive for some people. And I don't want to start that there because I know we're going to go down many twists and turns, but I want to start it with hope because I believe there's so much hope and I believe that you offer so much hope to mental health. So my first question is surrounding that if you could share one reason for hope, a breakthrough, an insight, something that can change lives, one insight, what would that be?
It would be that if you or someone you know is suffering from a severe, chronic, debilitating brain disorder that we call chronic mental illness, that there is hope because all of the research that we've been doing for decades is finally, once and for all, coming together, that these disorders are metabolic in nature, that these disorders are affecting brain metabolism. And by understanding that, we can actually sometimes offer powerful treatments that allow people to achieve remission and recovery from even diagnoses like schizophrenia and bipolar disorder.
Wow. So some people listening to that might even feel overwhelmed by thinking, okay, I've heard the word metabolic. I've heard the word remission. This all feels hopeful, but feels quite different to maybe how a GP might speak to me about it or a doctor when I go in and tell them my symptoms, or even a psychiatrist. So break down a little bit about what you mean around metabolic and mental health and then equals remission. How would you describe that to people?
The reality is that the science gets overwhelmingly complicated fast. And the other reality is that I am more than happy to do a deep dive into that complex science. But knowing that this is a podcast, I don't think people want that kind of complex science. So I am going to give you the quick soundbite.
Great.
That that metabolism can be influenced by genetics and epigenetics, but more importantly, metabolism is more often influenced by our biological, psychological, and social environment. And that means trauma and stress can play a role in our metabolism, that hormones can play a role, all sorts of things can play a role. But importantly, if you put it all together, if you put all that complex science together and see how it fits together, you can actually use very novel, unique interventions like changes in diet or changes in exercise or sleep or basic lifestyle medicine types of answers. And sometimes those solutions are counterintuitive. So we may get into it like something like the ketogenic diet, which some people might think of as a harmful or a bad diet, but in fact can have profound metabolic effects, especially on the brain. But that when you put all that science together, for some people, you can restore brain metabolism using a comprehensive set of basic interventions, and people can achieve remission and recovery.
So I love this quote in your book, which basically stems from what you're saying, that when a flower doesn't bloom, you fix the environment in which it grows, not the flower. And I think it's one of those like very simple quotes where we can start to understand like actually what is surrounding us that could be affecting us. And when I interviewed Dr. Lisa Feldman Barrett, she talked a lot about a metaphor of body budget. And we spoke a lot about our emotional health and our emotions. And she said, when we're depleted, our brain is in a body budget. And so we're drawing on other resources. And I found that a really clever way to think about our emotional health. And it feels very similar to how you talk about it. And you talk about something I'm going to go into, biology very quickly, but the mitochondria, which is what many people who listen to the show will know is the powerhouse of the cell. And you speak a lot about mitochondria health in relation to our mental health and our mental well-being and, poor mental health conditions. So if we were to kind of take this down a little bit into a science, short synopsis, if people are saying, well, I'm changing my diet or I'm getting out and I'm exercising, but I still don't feel like I'm making profound changes with my mental health, what would you kind of talk to them about thinking about their mitochondrial health to help make it as powerful as possible? Or whether they're doing the right thing, pulling the right levers?
For some people, it's going to be more complicated. And working with a psychiatrist or a physician or mental health professional who knows the complexities of this and all of the different strategies can be really useful. So I just need to say that up front. Because I'm not at all trying to say I've got this simple 5-step recipe to treat all of the mental illnesses on the planet and everybody will get a miraculous cure, because that's not realistic.
Yeah.
And at the same time, I am saying do not give up hope. That if you understand the formula and in this science, we can actually help the overwhelming majority of people. I really authentically believe that. So even if you are one of the people that it's not going to be a simple fix with a diet and exercise plan, please don't give up hope. But the basics are really the basics of lifestyle medicine. So I would want to look at diet, nutrition. I would want to look at movement or exercise, sleep, good restorative sleep without the use of any substances. So that means no alcohol, no marijuana, no sleeping pills, no melatonin, you should be able to sleep. It means minimizing harmful substances, use. So that's alcohol, marijuana, but it's also maybe some prescription medicines and some other substances that might be harmful for your health. We could get into environmental toxins because they probably are playing some role, and that gets more complicated in terms of how you avoid them. But another pillar is stress reduction. So the basic things that a lot of people know about: meditation, mindfulness, just removing yourself from stressful situations, And then the last thing is often relationships. I kind of throw in purpose in life because I think they go together. It doesn't always have to be about relationships. There can be Buddhist monks who live kind of in isolation and have a very strong sense of purpose, even without a lot of romantic or other types of relationships. So I kind of throw those two together. But I think those are the 6 pillars. And if you make sure that all 6 pillars are in the green zone, so to speak, that you're doing the right things in those, then more often than not, I really believe most people will achieve optimal health. The trickiest one of all is actually diet and nutrition, because there are so many factors and individual sensitivities and other things. So one person can have celiac disease or gluten sensitivity, and another person may not. So that first person may actually have horrible health overall when they eat grains, whereas another person might have perfectly fine health when they eat grains. And so recognizing, so there's not a one-size-fits-all diet is essentially what I'm saying. That there can be one-size-fits-all general health diets that work for a lot of people or even most people. But diet nutrition is usually the trickier one.
Yeah, I mean, speaking from a nutritionist here, I would 100% say that's true. And what I found really interesting is at the start of your book, you weren't saying, this is a book on nutrition and telling you what to eat. There's multiple factors, and you touch upon 2 different diets in that book. You touch upon the Mediterranean diet, and you speak about the SMILES trial, and Dr. Felice Jacka has been on the show, and we've spoken about the SMILES trial and adopting a Mediterranean diet. And obviously she was one of the first people to conduct an RCT, placebo control, that actually showed that people could go into remission just by adopting this modified Mediterranean diet. And I say modified because the bulk of foods was much more extreme. They were eating a lot more fruits, vegetables, whole grains than a standard Mediterranean diet. And then you flip the page and you're also talking about ketogenic diets as well, in psychiatry. So I thought that could be a really interesting place to go down, actually, is obviously at the moment, and you'll know this, the word longevity, everything is toted about within mental health and how we should be optimizing our diet. But they're 2 quite different diets. So someone listening to this, how can they navigate what they think should be going down? Was it the Mediterranean diet or is it the ketogenic diet? What's the kind of overarching answer from your opinion?
So I would say the first step in even questioning whether you might benefit from changing your diet is a really basic assessment of your metabolic health markers. So what's your blood sugar like? Do you have pre-diabetes or diabetes? Unfortunately, 50% of Americans now have pre-diabetes or diabetes. So 1 in 2 people are going to have to say, oh, that's a problem for me. I want to look at your lipids, HDL cholesterol, LDL cholesterol, triglycerides. I want to look at inflammatory biomarkers. I want to look at waist kind of circumference or abdominal fat. I want to look at blood pressure. And with those markers, and I will even take the inflammatory biomarkers out because they're not officially part of metabolic syndrome, but those general markers, so blood glucose, HDL cholesterol, triglycerides, blood pressure, and abdominal fat, abdominal obesity. Those 5 biomarkers are biomarkers of what we call metabolic syndrome. And right now, only 7% of Americans have none of them. 93% of Americans have at least one abnormality in those 5 simple biomarkers. And that means, so if you are in that 93% category, it means that there is something about your lifestyle, so those 6 pillars of lifestyle medicine, that is off, more often than not, diet is one that you should at least consider. Now, again, you might be following the perfect diet and not sleeping well, or you might be following the perfect diet and be in an abusive relationship. And there's no way a perfect diet is going to overcome the adversity and the health consequences of being in an abusive relationship. So I don't want to make it simpler than it is, but barring those type of examples, for a lot of people, diet, nutrition is playing a key role. And increasingly, like in Western countries, such as the United States and the UK, increasingly the consumption of ultra-processed foods is being found more and more to play a harmful role in human health and human metabolism, including mental health, including depression, anxiety, but even bipolar disorder and schizophrenia. And unfortunately, in the United States, about 60 to 70% of people's calories now, on average, are coming from ultra-processed foods. That's a real problem.
I'm so pleased to partner with Squarespace, the all-in-one platform to help entrepreneurs stand out and succeed online. Whether you're just starting out or managing a growing brand, Squarespace makes it easy to create a beautiful website, engage your audience, and sell anything from products to content all in one place. I've been using Squarespace since day one because it's accessible and it looks professional, even for a tech phobe like me. Squarespace gives you all the tools to create and sell your own online courses. I launched my own Inner Circle membership last year using their platform. You can upload videos, customize your layouts, and add a paywall to monetize your content. Now, if you're looking to grow your business, the email campaigns feature is a game changer. It allows you to create targeted email campaigns, engage your community, drive sales, and track success with built-in analytics. Head to squarespace.com/livewell for your free trial. And when you're ready to launch, use the offer code LIVEWELL for 10% off a website or domain.
That's a huge problem. I think it's one of those, I think there's two extremes happening. I think we're either dosing ourselves up on so many supplements and vitamins, or we're eating ultra-processed foods. And we're kind of sitting in two quite extreme camps at the moment of where we are. And as you're talking about it, the one thing that we haven't drawn a correlation to is obviously the rising kind of obesity epidemic. And then you've got the rise in mental health epidemic at the same time. And you're basically saying that you don't think it's a coincidence that we've got metabolic syndrome rising and our mental health is getting kind of weaker and poorer at the same time.
It is not at all a coincidence. And we actually have really good scientific reasons to believe that. So we do have strong correlational studies or epidemiological studies. And everybody then argues, well, correlation doesn't equal causation. Yes, I get it. I know that. So then we go into, well, is there any mechanistic studies or are there any animal model studies where we expose animals to high levels of ultra-processed foods, for instance, and then do they develop symptoms of depression or anxiety or metabolic syndrome or obesity, diabetes, other things? And we have thousands of research articles on that. So, yes, correlations are there, but it goes far beyond correlations. And ultimately, the way I think about it, so a lot of people think about obesity as just a disorder, a disease of willpower, that people are just, they just love the taste of tasty foods and they can't put it down. And diabetes, usually type 2 diabetes in particular, certainly not type 1, but type 2 diabetes is often thought to be just a consequence of obesity. Those people are just over-consuming calories. And if they would just stop over-consuming calories, everything would be fine. Instead, I think of both disorders, along with cardiovascular disease and others, as actually much more complicated disorders that do involve the brain as well, because the brain is actually helping to regulate your appetite, whether you feel full, but it's also helping to regulate your whole body metabolism, how many calories your body's actually burning. And so I think about obesity and diabetes as metabolic disorders, that they are disorders of cell function, that cells somewhere in your brain or body are not functioning optimally. And that is resulting in the symptoms of being overweight or the symptoms of glucose dysregulation that we call diabetes. And at the same time that's happening, your brain might be affected too. And if your brain is being greatly impacted, it might come out as mental illness. And this actually spans the whole spectrum of what we call mental disorders. So if your parents are metabolically unhealthy, it might actually impact your neurodevelopment. And it's through no fault of the child's. You're the little fetus inside your mother's womb, and like it's not on you, but you may actually have neurodevelopmental differences, if you will, that might end up showing themselves as autism spectrum or ADHD or a learning disorder or something else. And for those who don't know, the rates of all of those are skyrocketing. Rates of autism have quadrupled, and recent evidence over the last couple of years says that the rates are probably even higher than that now.
It's like 178% or something increase.
It's out of control. And I don't think it's a coincidence. Again, this isn't about shaming parents. This is about understanding that parents who are overweight or obese have a metabolic problem in their cells. They often don't know why or what's wrong or what they need to do about it, because they're getting such conflicting advice about just eat less. You can keep eating those ultra processed foods. Those are fine. Just eat less of them. And I actually don't think that advice is helpful at all. I think that advice is still harmful. Because people can't sustain that you can't eat less of a toxic food. So if parents are metabolically compromised, and that can be a lot of things, it just older age. So a father who's older is more likely to have a child with a neurodevelopmental condition, for example, because we get metabolically less healthy as we get older. But that's one spectrum. And then there's everything in between: depression, anxiety, bipolar, schizophrenia, and then all the way to neurodegenerative disorders like Alzheimer's disease. That there's, some people are coining the term type 3 diabetes to say that Alzheimer's disease may in fact be diabetes of the brain, which essentially means your brain isn't getting enough energy from glucose. It's a brain metabolism problem. And that is why brain cells are actually slowly but surely shrinking and ultimately maybe dying, because they are metabolically compromised.
I have two questions coming off of that. One was around autism. So my sister had gestational diabetes during her pregnancy, and my niece is autistic. And obviously I, as a nutritionist, was reading into, autism a lot more, and seeing the rise in autism, even within my family line, for me sparked a moment of, well, what's happening here? My sister isn't overweight. She's thin. She does high rocks. She does all of those, she doesn't eat ultra processed foods, but somehow she had gestational diabetes. My dad's a type 2 diabetic. So there's obviously a line within us that's got a genetic link to this. So for people that are thinking about this, and whether it's autism, ADHD, whether they're pregnant or whether they are neurodivergent, what type of diet should they be looking at to help reduce this? Because if I'm thinking about this and how you're elaborating it, if we change that, we can actually maybe change the symptoms of autism and ADHD.
We can. So ultimately it could start with parents and even pre-pregnancy. So again, looking at your overall metabolic health markers, it sounds like your sister was metabolically healthy, and then something went wrong during pregnancy and she developed gestational diabetes. And we actually know from large studies that gestational diabetes increases the risk of autism. So that was at least somewhat related. Now, is that the only factor that influences autism? Of course not. Like, I don't want to make it that simple, but it does significantly increase risk. And some studies suggest maybe up to double the risk for a woman who has gestational diabetes, that her offspring have maybe double the risk of developing autism spectrum disorder. So what can we do about that? What I would say is that as soon as your sister developed gestational diabetes, if we can try to identify what might be contributing to this, is it related to diet? Is it related to, again, the 6 buckets of the lifestyle medicine? Is she sleeping okay? Is she using any harmful substances? I'm going to be even look more closely at prescription medicines or vitamins or supplements or other things that she's taking that she might think these are good for me, but if she's got gestational diabetes, that's a sign. That's like a warning siren going off, like something's wrong. And, but I'm also going to look at the basics of, stress reduction, relationships, purpose in life, movement, exercise, these other things. And if we're not finding anything, then yes, the next thing that I would go to as a scientist is she being exposed to some environmental toxin? So is she being exposed to high levels of microplastics or forever chemicals or other things that even though she is on the surface thin and otherwise healthy, again, gestational diabetes is not normal. We can't just accept it as this is a normal part of pregnancy because it's not really supposed to be a normal part of pregnancy. But I believe that if we make a concerted effort to say enough's enough, we've got skyrocketing rates of both metabolic disorders and mental health disorders, and we can figure that out. Like, let's look at a group of 100 or 1,000 women just like your sister who on the surface are metabolically healthy. They're thin, they're exercising, they're sleeping well, they have good relationships, they're not using drugs or alcohol. Let's study them.
Yeah.
Why do they have gestational diabetes? There is an answer. There has to be an answer. And we are humans, and it's 2024, and we can figure out the answer. But it does mean we need more research funding. We need to study that and try to figure out what is it. And maybe we are looking for the levels of microplastics in her bloodstream, or again, other environmental toxins in her urine or her hair or something else, trying to figure out what is this? Why would this happen? Because if we can understand that, then we can do prevention. We can definitely do prevention, maybe treatment. I think to your other question, though, what can we do like early in life? If you notice that a child is showing signs or symptoms of neurodevelopmental differences that are concerning, again, so I'm somebody who is different maybe, and so I happen to be gay. That's a difference. I didn't choose to be it. So we as society are going to need to learn to tolerate some variation in humans. Not everybody's going to be a genius with blonde hair and blue eyes. And so we're going to have to accept a range of diversity. And yet there are neurodevelopmental conditions that do impair people's ability to be independent and happy and thrive. And so if we can identify those, I think we could easily come in with these comprehensive holistic interventions. For a young child, I really can't offer a one-size-fits-all, like they should all go on this diet. But I think there are lots of dietary changes we could look at. I think we could do analysis of their gut microbiome or inflammatory biomarkers or other things. And I think based on the results of those kind of assessments, we can develop science-informed strategies.
I think that's such a beautiful thing to mention, because I got into mental health because I was diagnosed or blessed with dyslexia when I was studying biochemistry and nutritional science. And my own mechanism wanting to understand how we can support our brain health more with nutrition. And I do believe that we can. And I think when I was reading your book, what I was
getting from it was the Mediterranean diet is fantastic for prevention and thinking about the gut microbiome. And the ketogenic diet, which I went on to study later on for children with epilepsy, is used when you are really struggling with a mental health condition. And that could be a very good route to access as one potential treatment. Was I interpreting that correctly?
100%. I think, well, maybe not 100% because there are so many caveats and exceptions.
I get anxious when I don't get 100%.
But that is actually the way I think about it. I think the Mediterranean diet can be a very good generic health and wellness diet for the masses, and that can actually, if it's replacing a diet high in ultra processed foods, that might be enough. Because really the intervention is less about the Mediterranean diet and it's more about removing the harmful ultra-processed foods that you're consuming. So we're going to remove some of these harmful ingredients and substances and replace them with real whole foods, and people may get better just alone from that. But the ketogenic diet I do think about it as an intervention. I think about it less as a diet and more about a metabolic intervention that can profoundly change brain metabolism. For those who don't know, the ketogenic diet is actually a 100-year-old evidence-based treatment for epilepsy. It can stop seizures even when medications fail to. And the reason that's so important to me as a psychiatrist is that we actually use epilepsy treatments in psychiatry all the time for a wide range of mental health conditions. A lot of the pills that were developed to stop seizures are actually now used as mood stabilizers, antidepressants, anti-anxiety medicines. Sometimes they have antipsychotic properties even. They're used in addiction treatment, eating disorder treatment, like a wide range of mental health conditions. And so if this diet can also stop seizures, it's not at all unreasonable to think like, what is that doing and how is that working? And the reality is we've got a tremendous amount of science, and that's one of the things I've been really passionate about pursuing over the last 10 years now.
As a nutritionist, one of the most common questions that I get asked is coffee good or bad for you? Yes, coffee is good for you, but the impact of the health benefits all comes down to how the coffee is sourced and made. What's really important to consider when choosing your coffee is knowing that not all coffee is created equally. I came across Exhale Coffee by Dr. Rupi, who oversaw 9 independent lab tests to ensure the coffee is sourced to maximize the polyphenol content. This is a potent antioxidant with anti-inflammatory properties to support overall health. Switching to a high polyphenol coffee like Exhale is also fantastic for your gut health and your brain health, because research has shown that these specific components may have a real impact on our immune response. It could even help support your oral microbiome when drinking up to 2 to 3 cups a day. But over 5 a day has been shown to have detrimental effects. Personally, I love to have my coffee an hour after waking up to allow my body to use its own natural energy resources within the first hour and to align with my circadian rhythm. What I also love about Exhale Coffee is that it's also soil certification organic certified, which means that it's free from mycotoxins, pesticides, and molds. Now, if you want to give your mornings a new routine and try Exhale Coffee, then head to www.exhalecoffee.com/Sarah to get your free trial sent to you.
I can see that from reading the book. You know, the kind of amount of notes that I was taking down from the studies was huge. And I think, you know, when I was reading it, I was really thinking about my conversation that I had on this show as well with Dr. Casey Means, who wrote the book Good Energy, and she speaks a lot about mitochondrial function and the importance of it to have good energy. And it's specific as well for obviously mental health. It then brought my kind of idea around a very big emerging conversation on the pharmaceutical side of things, which is where we're thinking about mitochondrial function and we're thinking about mental health, or we're thinking about physical well-being. obviously there's a pill for everything. So when my dad was diagnosed with type 2 diabetes, of course he was given metformin. As a nutritionist, I was really wanting to intervene and change his diet as the first mode of entry, and to see if we can do that first. And then medication comes as a kind of a second intervention if everything else fails. Thinking about where we are now with our health, yes, we are an obesity epidemic. Ozempic or GLP-1, it's everywhere. So people might be listening to this thinking, okay, well, Chris, that sounds interesting. If I just lose weight, will my mental health improve? And so I wanted to ask you around, what are your thoughts on Ozempic? Because people might be thinking about that as a mode to entry, hearing about, metabolic health.
So the reality is that there are many clinical trials now underway of using medications like Ozempic for a wide range of mental health conditions, addictions to a wide range of substances, but also depression, Alzheimer's disease, bipolar disorder, and other mental health conditions. So I think for some people, a medication like Ozempic might play a role in their recovery path. My concern is that obesity, again, I think of obesity as a metabolic disorder, that it is not a disorder of willpower. It's a disorder of deranged or dysregulated metabolism, which includes appetite and satiety signaling and other things. That there is something causing that obesity. The problem with obesity is that it becomes a vicious cycle, that the obesity itself actually makes the condition worse, because obesity itself can increase inflammation, which can make things worse. It can dysregulate hormones even more, and then that leads to this vicious cycle. So I think there's some evidence that using a medication like Ozempic can help at least break the cycle, or at least stop the progression, or minimize or reduce the progression. But foundationally, I'm 100% with what you said before about your father and, early diabetes. There's a cause. There's an actual root cause from our environment. And instead of treating the cause with a pill that can help reduce symptoms or manage the illness, why don't we at least look for the root cause, which might be diet or a lack of exercise or a lack of good sleep or heavy substance use or other things. Those 6 pillars, again, I'm going to stop at 6. Let's do the 6 pillars and then we're done. So it's not this never ending complex. It's too hard to figure out. It's not. It's not that hard to figure out. And if we can address the root cause, we may not need any pills. Much more important and foundationally for me is that if you simply take a pill to reduce the symptoms, but you don't remove the root cause or change the root cause, you're probably going to have continuing health problems that are slowly but surely going to continue to get worse. And so for a lot of people, they kind of struggle with that. And if you're one of the people struggling with that, if I can offer a simple analogy. If you are allergic to poison ivy, and every morning somebody rubs poison ivy on your skin, and you get a rash, a symptomatic treatment would be putting some steroid cream on that rash, and it will make that go away. But if people keep rubbing poison ivy on you every single morning, you're going to need to use that steroid cream every single day. And at some point, the steroid cream might start to have side effects or may become less effective, and then the rash is going to come through anyway. But you're not really addressing the root cause, when in fact the root cause is easy to address. Stop rubbing poison ivy on this person because they're allergic to it. Just stop. And when we think about ultra processed foods, for example, it's a similar analogy. It really is that simple. Like if you're putting that into your body every day and you are having a harmful reaction to it, yes, you can treat it with pills, Ozempic, metformin, an antidepressant, or you could just stop putting it into your body and let your body heal and recover.
Such an important thing to mention that I read in your book that 30% of people with major depressive disorder fail when they just take an SSRI. So it's only 30% of people that actually go into remission. 70% of people don't get any remission from it. And I think putting it in that statistic, you know, it's interesting. I think when a lot of people here in the UK, and I'm sure in the US, would go to their doctor, the first line of treatment is maybe an SSRI to go on to start helping them feel better. And when you're looking at the stats, as what we were saying, over 1 in 3 people are affected by neurological conditions, and more than 3 billion people are living with a neurological condition in the world. And that's huge. So there is kind of a really big answer here. I think the one thing that came up when I was thinking about this was, how do you define a mental health illness? Because you've obviously got a range of emotions. Being a woman, I can identify with all of them. How do I know when that becomes problematic, or if I'm just experiencing a range of emotions and that's quite healthy?
You know, so there are some really easy situations, and then I'll talk about, yes, there are some gray areas where it can be really difficult for people to tease them apart. But in some cases, it's actually quite straightforward. So if you have adversity in your life, you fail a test, and your parents are super disappointed in you, and you begin to worry, oh my gosh, I'm not going to be able to go to the college that I wanted to go to, or I'm not going to be able to, get the career that I wanted because I failed a test. Maybe I'm not as smart as I thought I was. Most people will get depressed and anxious from that. And that, early on in the first few days after that, that is not at all a mental illness. The symptoms are identical to somebody who is having a mental illness, but it's not. But that person may be very, very depressed, maybe beating themselves up. They might even transiently think, maybe I'd be better off dead. If I'm just going to be a worthless, stupid failure for the rest of my life, maybe I'd be better off dead. I mean, it could be that extreme. They may have trouble sleeping. They may lose their appetite. They might feel sick to their stomach and nauseous. So all of the symptoms of really crippling mental illness are happening, but there was a clear cause, and it's a short-lived, understandable, expected reaction. And I would argue that person does not have a mental illness. Now, DSM-5, TR, and ICD, criteria say that, well, if those symptoms of depression last for 2 weeks or more, then that's a mental illness. And I would kind of disagree with that. And again, I'm just going to use the common sense bucket. If you've been married for 30 years and you have 3 kids and your spouse cheats on you and then divorces you, you're going to be depressed. And it's probably going to last more than 2 weeks. And I don't think those people have brain disorders that are causing the symptoms of depression. I think those people are having a very normal, understandable reaction to adversity and relationship failure and betrayal and all of that. On the other extreme, there are people who can be going along in their life, living the dream. Everything's great. And then out of the blue, they get an infection, let's say, and they develop crippling depression, and they don't know why. And they have no energy, and they can barely get out of bed. And this kind of thing is happening in people with long COVID, for example. And that can persist. So usually you would just say this is an infection and whatever. But if it persists for months on end or years on end, it's clear that that person has something going on with their brain function, their body function, and there's a problem. It's a biological problem, but there's a problem causing their mental symptoms. And that person can actually start to feel suicidal. That person can feel, and I would say that's not normal or acceptable anymore. There's something wrong with this person physically, I would say, and that we need to address it. And there can be other people who have hormone imbalances out of the blue. So women going through menopause, for example, they can be perfectly fine. And then over a period of months, start to develop unrelenting depression, and they don't know why. And they just happen to notice, oh, my periods are getting less frequent, or they're going away, and I'm having some other changes. But those hormones can actually impact your brain function and your brain metabolism more specifically. And so as those hormones are declining, women's mental health can suffer. And I would say that is probably more in the camp that I would call a disorder, that it's not a normal expected thing for everyone, that there's something wrong because of this thing. There's something wrong with the functioning of the brain. It's not functioning optimally anymore. And I would say that's a mental illness, and we can actually help people identify what's causing that and correct it. And of course there are things in between where it's kind of like, well, how long does the guy whose wife cheated on him and left him, how long does he get to be depressed before we call it a disorder? Yeah, I would say more than 2 weeks. Can it be 3 months? Sure. Can it be 3 years of chronic, unrelenting depression, still unable to get out of bed? I'd say, no, 3 years, that's way too long. Where do I draw the line? I don't know. It's going to depend on the person and circumstances and lots of other things.
And the symptoms, I think like one thing that I was relating to that was post-traumatic stress disorder, right? So that could also be in relation to when something quite traumatic happens and you've been in this relationship for 30 years and all of a sudden there's this huge betrayal or a different type of symptom. PTSD affects 8 million adults in the UK. I think it's a really interesting realm in mental health because I am a big believer, and I can never pronounce his last name properly, but Belzer van Derverhof, who does Body Keeps the Score. I'm a huge kind of fan of his, and he talks a lot about PTSD being quite separate from a lot of mental health conditions, very different to how depression is, but we kind of treat them in a similar way, or we do, especially here in the UK at the moment with the pill. What's your understanding around people that are suffering with PTSD? I don't think it's one that's spoken about enough at all.
So, I would say PTSD falls in this same kind of spectrum that we were just discussing. That when people are traumatized, when their lives are threatened, or even just they believe that their life is in danger, just the perception of that will usually, more than 90% of the time, or more than 90% of humans, it will create all of the classic symptoms of post-traumatic stress disorder. That they are normal and expected reactions. And that means people will not be able to sleep as well. They will have hypervigilance. They will startle at anything. That basically their threat system is on high alert, because their life was just threatened and they are looking for danger everywhere they go now. Even if they go back to the comfort of their own home, I believe this is the way we as humans are actually hardwired, that it's protective. That if we get attacked by another tribe or another person from our own tribe, that we should be on alert. Like once they've attacked us once, who knows, they're not going to come back again. Maybe they're going to come back again and attack us again. And so we need to be on high alert. That's protecting us. And that means, unfortunately, we should not be sleeping soundly through the night, because sleeping soundly through the night leaves you vulnerable. And maybe they'll come in the middle of the night and try to kill you, or harm you in some other way. And you need to wake up. If you hear any sound at all, if you hear the creak of a door, you need to wake up, because it could be them lurking around the corner. So So on one hand, I would say trauma reactions and the symptoms of post-traumatic stress disorder are adaptive. They're horribly unpleasant. I'm not trying to say that they're a good thing. They are horribly unpleasant. It is torture. It's torture for people. Torture. And yet your body is simply doing its best to try to save your life because it is hardwired to think, oh my gosh, no, danger, danger, danger. Like be on alert. And going without sleep is really even makes everything worse and all that. The issue is that trauma response is actually changing your metabolism at the very first second it happens. As soon as you have a trauma response, we usually call it fight or flight, but fight or flight is changing your metabolism. What is it doing? It's making your heart rate go up. That's changing your metabolism. It's making your blood sugar go up. That's changing your metabolism. It's making your inflammatory biomarkers go up. All of these things are happening to allow you to fight or flee, because you need metabolic resources in order to fight or flee. So you need higher levels of glucose. And normally we think of high levels of glucose as a bad thing, but when you're about to sprint for your life, high glucose is a great thing. It's going to save you. You can't be having hypoglycemia as you're trying to run away from your predator or attacker. Fainting. Yes, you would be fainting. That would be awful. So again, your body is trying to protect you through these metabolic changes and metabolic adaptations. When that trauma response goes on for a prolonged period of time, or when it is just really extreme, even if it's over a short period of time, if it's really extreme, it can actually take a toll, a metabolic toll on people. And it can actually, we have good scientific data on this. It can actually be harmful to mitochondrial function, and make changes in mitochondrial function. And what that means is that it's foundationally changing your metabolism. And over time, what that means is that you might end up having persistent symptoms of mental illness. And it's not just PTSD. It's essentially most of the mental disorders. It can be depression, anxiety. Maybe people start using substances. Maybe people have insomnia. Maybe eating disorder, personality disorders can come out. Maybe people, even develop bipolar or schizophrenia. That we know that people who have childhood adversity, childhood trauma are much more likely to develop bipolar disorder and even schizophrenia. So it's really the whole range of mental disorders. And interestingly, at the exact same time, the metabolic disorders too. People with trauma are more likely to subsequently develop obesity, type 2 diabetes, cardiovascular disease, and they're more likely to die early deaths from those. And so what I'm arguing is that trauma impacts human metabolism and that we can understand that. And the reason that's important, we can't unfortunately go back in time and undo that trauma for the person. But what we can do is if we understand that this is a metabolic problem now, or that metabolism is playing a role, that we can actually offer more holistic, comprehensive interventions to that person. And yes, psychotherapy is still going to play a role. Maybe medications can play a role for some people or should play a role for some people. But in case you don't know, and as Dr. Vanderkolk talks about in his book, like they fail to work for way too many people. Just medicating them is not the answer for a lot of people. And so instead, I would much rather use holistic strategies that might include changes in diet and nutrition, sleep, exercise, other things, stress reduction, other things. And this is where I think about the nutrition or diet more like an intervention as opposed to blaming a bad diet for the cause. So this is a clear example where the cause was obvious. It was trauma. It has nothing to do with what the person was eating. And yet the trauma can cause metabolic dysfunction that increases their risk for obesity, type 2 diabetes, and a range of mental disorders. And sometimes we can use our nutritional interventions, metabolic nutritional interventions, to actually address this and help people heal and recover. And that's where I feel like this science can be so powerful and so filled with hope.
So much hope.
And as a nutritionist, you know that like even if in your head you're thinking of, oh, I'm doing all these complex things with insulin signaling and inflammation, everything, what you're really telling the patient is you're going to eat this dietary plan for a little bit and we're going to change your diet and it's going to help you heal and recover. And so for the person, it's not that complicated. It can end up feeling like a straightforward intervention.
What about psilocybin? Because there's also that argument where you can feel in so much shock. And I've experienced this where I've lost my appetite. And I mean, even drinking water was like stressful. And so you can shut off your signals, your appetite signals, because your body is in fight or flight. So what I found really interesting is looking at, things like yoga, different movement. You speak a lot about this in your book. You also do mention psilocybin for treatment, but it was a very short paragraph. And that's why I wanted to kind of bring it up, because I have seen so much different emerging research. Obviously, this is quite new research that's coming to the forefront, so it's still very early. And then I looked on X, on Twitter, and then I saw a very recent tweet about saying you've got to be really careful about psilocybin use, because actually, yes, there might be benefits, but also there can be real negatives here at the same time. And there is this big explosion, I think, of people maybe using it recreationally to explore and understand, but maybe with not as much caution as we should. So what's the science and like your interpretation really with psilocybin and mental health disorders?
So I think you just gave a great summary. And this field is an emerging field. Lots of people are interested in it. Lots of neuroscientists and psychiatrists and mental health professionals and others are all interested in this. And countless patients and families are interested. I think that, that there's a foundational question of how does it even work?
Yeah.
And increasingly we're seeing that the most common term used is that it may increase neuroplasticity, which basically means it allows people to learn new things or incorporate new paradigms. I actually can easily integrate that into brain metabolism, because you can't have a growing, thriving brain or neuroplastic brain without increasing its metabolism, because metabolism is required to build new branches or connections or parts of neurons. And so they go together. But so something like psilocybin can increase neuroplasticity. And in the clinical trials, even what we find is that can be a good thing for some people, and for others, it can be a bad thing. They can have what's called a bad trip. And if they are not in the right set and setting, is what they often talk about. Set and setting are really important. And it can actually lead to a bad experience. And then if that bad experience gets reinforced, you can actually come away from it kind of not doing as well. It's kind of like exposure therapy in cognitive behavioral therapy. Exposure therapy can be great as long as you do it right. And when you do it wrong, it can actually make your illness worse and your fears even worse. And so same thing goes for psilocybin. You've got to do it right. And because it could be a good thing, or it could end up making your illness even worse. And then the research that you alluded to shows us that just out recently that people who end up having a bad trip become psychotic from hallucinogens. And I mean, that is actually the definition of what hallucinogens are doing, is making you psychotic. So they are altering your perceptions, your, other things. But if that ends up being a bad experience and you go to the emergency room for that, which some people do,
yeah,
you actually end up having a 20-fold increased risk of developing schizophrenia over the next 3 years. And so some people will interpret that as, well, those were just people who were about to become schizophrenic and the psilocybin pushed them over the edge. I actually believe it's more complex than that. And maybe those people never would have developed schizophrenia had they never tried psilocybin. That psilocybin, yes, may have pushed them over an edge, but I think about it in terms of a metabolic edge. And that if we had not pushed them so profoundly, maybe they never would have developed a psychotic disorder. Nonetheless, if we understand that science, even if somebody develops symptoms of schizophrenia as a result of using psilocybin, I believe we can help them heal and recover. I really do. But we've got to be more sophisticated. And it's not just throwing pills at them. It's understanding, what did we just do to their brain metabolism and how can we fix it now?
Do you think there will be a treatment for psilocybin in the years to come with mental health? Like proper treatment?
Will psilocybin be used as a treatment?
Yeah.
I think there's so much energy and push right now to make that happen. It is highly likely. I don't know if you know, but the MDMA, or ecstasy, was just denied FDA approval in the past few months. That they were trying to get that approved as a treatment, and the FDA denied it. So that denial may hold back some of the research funding a little bit on psychedelics. But like, even we at Harvard Medical School, we have a consortium of hospitals, and we are kind of considered the conservative kind of place to be. We've got a psychedelic research program for mental health. So if it's coming to Harvard, it's coming soon because if it's good enough for the old stodgy people at Harvard, it's probably going to be good enough soon enough.
I love that. So if it's at Harvard, it's coming to your screens and your chemists very soon.
Exactly.
So something that I loved that wasn't in this part of the episode, but it was in our Substack, which was the 5 questions to nourish your mind, body and soul, is that I asked you something that what makes you uniquely you. And you said that you grew up hating yourself. And I think for most people that would shock people. And on others, it wouldn't. I really believe that so much of our work is driven by our purpose and passions. If we go into something where we're really wanting to communicate it very heavily, at what point did you realize? Because I had this as well, and I'm really interested. At what point do you realize that that's how you saw yourself?
It was pretty early. It was, I think by kindergarten, I realized that I was different. So as I mentioned, I think one of the primary drivers of me hating myself is that I'm gay, and I was raised Catholic. I was going to church every week, sometimes multiple times a week. So I was an altar boy for a while. So sometimes I was going to church 5 days a week, or 6 days a week, and hearing on a regular basis how I was going to burn in hell because I'm gay, and that God would never forgive me, and that there was no hope for redemption, and that I just needed to change. And I, went for years just praying and praying, asking God to change me, and he never got around to it. And unfortunately, and I tried what I could, but it just was not something I could change. But I think even in kindergarten, even though I didn't know what sexuality was, I didn't know what sexual orientation was, I don't think I even knew what sex was. I knew I was different. I knew that I wasn't the same as everyone else. I also had OCD as a young child, and that was never recognized. It was never diagnosed. Nobody ever, I didn't know what it was. Again, I just knew that I was different. And so I had these thoughts and feelings and behaviors that I knew were somehow bad and different, and that I should not talk about them with other people, anyone at all, not my parents, not my best friends, nobody could know. And then that just leads to this immense sense of shame and guilt and humiliation and isolation and loneliness.
I feel like I connect a lot to that from my brother, who grew up very similar, and grew up gay and felt that he was always very different. And I'm 10 years younger, so seeing his struggle connected me a lot to understanding that different is so beautiful. I find it interesting in how you speak about feeling different, because I think actually the difference is the beauty of people. And now, would you see that as one of your strengths and not one of your weaknesses?
I do. I do see it as a strength. Again, I think because I'm a psychiatrist, so as soon as somebody comes in and tells me about their story or says, you wouldn't understand, you don't know what I feel like, you don't know what it's like to hate yourself, I never tell people, oh, I know exactly what that's like, because everybody's experience is different. But I can actually let them know, no, I actually do know a little something about this. And I think the thing that's most helpful clinically is that a lot of times people will feel so alone in that same way, and they will feel so ashamed. And I anticipate that. And then they will be too ashamed or too afraid to tell me what they're really thinking. And then I can say, I wonder if you're thinking this. And they're like, how in the hell did you just know that? Like, how on earth would you know that? I'm like, well, because I've been around the block one time or two. I know a little something about this psychiatry thing and about what it's like to hate yourself. I don't necessarily open up with my own story with all of my patients, because that's not appropriate, and our time isn't for me to tell them about my woes. It's to help them. But it unequivocally helps me connect with people. And then even when I'm speaking with large audiences, whether it's speaking at a conference or on television or radio, like that's just a part of who I am. I've had some people say, like, you're just so genuine and authentic. And I'm like, well, how else should someone be? Like, why would anybody not be genuine and authentic? I don't understand that. But yeah, I think what they really mean, even just by genuine and authentic, is not just that I am myself, but that I'm familiar to them. I feel familiar to them, because so many of these struggles, as you just said, like you can relate to some of this. I think most people can relate to some of this, and yet most people aren't willing to talk about it, let alone wear it on their sleeve, like be very open and public about it. And I actually feel like we will never overcome the shame and stigma of mental illness until we start talking about it, until we start owning it and just saying, this is actually not unusual. It is not unusual to feel this way, and you're not alone. And there's a whole community of people here who want to help you and help support you.
I think hearing that gets you through so much of the darkness. And for me, what I talk about a lot on this show that helped me through my darkest moments, and, I'm sure I have many more to come in life, is compassion and self-compassion, because I grew up very similar and not liking myself, but didn't really realize that was, how I thought that's how everyone was. And I think when you speak about the concept of doing something nice or being kind to yourself, it can really put a mirror to your face, and you can go, well, I don't speak to myself in any way that's kind how I would to a friend. So today, like, from everything you've learned, I guess, like personal to intellectual, I mean, you've like combined everything together. How do you keep that in check? How do you make sure that those kind of everything that you went through when you were younger, the adversity, the criticism, the pain, the disapproval, the rejection. How do you try and keep that at arm's bay and not let that interfere?
It's hard for me to be able to articulate how I got to the place I'm in, because there are risks with both sides. So some people want to just, if they've had experiences like this, or if they've had a past similar to mine, they just want to forget about it and just leave it behind and move on and be a new person. And there are benefits to that, obviously. Well, I'm a new person. That was 30 years ago or 50 years ago. Who cares? It doesn't matter anymore. I'm a brand new person, and that's irrelevant. And that works for some people. It's not what I chose to do or what I want to do, but the other extreme are the people who have trouble moving on and have trouble letting go, and they still are somehow stuck in that past and that, and just in those feelings and those perceptions, and hating themselves or feeling inferior or feeling less confident than they should be. I don't know how because I actually, for me, I feel like I'm at this sweet spot where I can go there. I can go back there in my mind and remember the feelings. Like I can remember them so crystally clear that I'll start crying. And I don't do it to be dramatic. I do it because I remember, oh my God, I remember what that feels like. It was so awful and painful and awful. But I don't get stuck there anymore. Like in the past, I would have gotten stuck there. If I started crying, it was like the end of the world, and I'd be suicidal for days or whatever. like I don't get stuck there. I can kind of put my toe in that water and then take it out, and then take it out and be like, but I'm a new person now and I'm okay now. And for whatever reason, this mission that I'm on to help people with mental illness, I think I don't think I'd have it any other way. I don't know that I set out to achieve this. I know I did not set out to achieve this. So I don't know how I got so lucky that it just happened that way. But somehow I can tolerate going back there and remembering it and experiencing it. But I can also be solidly here in the present in a safe place that I feel good about myself, that I feel good about other people, the world I live in. And yeah, it helps me with the work that I do.
Helps you get up every day. Well, I think it's a beautiful story that you wouldn't have it any other way. I think people that communicate their important work is because they want to make a difference. So, I believe the greatest teachers are the ones that have been through the hardest times. So it leads me to my final question, Chris, which I ask all my guests, and funnily enough, it's never the same answer. So I'm interested to see what yours is, which is, Chris, what does live well, be well mean to you?
The thing that's coming to me off the top of my head is that living well is actually not as hard as it sounds. Being well is what everybody wants and strives for, and they turn it into something so complicated or so unattainable, and they feel like, I can't be well. That's an impossibility. But that if we do live well with some basic kind of, I'm going to simplify it to lifestyle strategies, but it's more than that. But if we do live well, we can actually make ourselves be well. We can actually make ourselves well. And that it is the ultimate goal, and it's not as unachievable and difficult to attain as most people think it is.
I love that. It's starting with hope and it's ending with hope, which is great. And I would definitely advise everyone to go and buy your book, Brain Energy. I will put it in the show notes. And thank you for all the work that you're doing, pioneering in this field of mental health. And I hope we can do this again soon.
Awesome. Thank you so much.